lifespan of any B cell memory cell is around 20 to 25 years. Okay, so we can able to have that expectation that these vaccines, because this will produce the memory cells in adults, because it is we can able to see in pediatric populations, and also it will produce the adult population. That means we can expect that 20 to 25 years, because it will produce the memory cells.
Then you have to repeat it.
By the time the man will die.
Then time will die, because
If he has to give 75 years, he will die.
Yeah.
So second dose not required.
And then if you don't,
If you don't die, then he may.
then
Dr. Light will be called.
কত বছর আছে?
to give you
তোমাকে মনে আছে?
ততদিনে অন্য কনজুগেট ভ্যাকসিন
হ্যাঁ আরেকটা আছে।
Cost এগুলো বলো।
that is the cells for
Delivery.
হ্যাঁ?
which is be called for rebirth.
And there are two questions.
Question.
One is this pneumococcal vaccine is given to prevent the pneumococcal infection. That is the primary motto. So the patients, particularly those who are transplant patients, whether you will change the schedule, that means whether is there any need for second dose, because they are already on the immunocompromised drugs. Number two, in case of HIV, we know that CD4 cell count is very low. So whether you will advise this pneumococcal vaccine before the starting of heart or after the starting of heart, number one. And number two, whether you will change the schedule, because their immunoresponse will be very low.
Okay, sir. Actually, recently ACIP they have provided their recommendations. ACIP is the Advisory Committee of Immunization Practices, USA. So they have specifically mentioned that if there is a patient like a high risk patient or a patient having transplantation, so their patients has to be provided the conjugate vaccine first, and also followed by the polysaccharide vaccines. And if it is required, then you have to provide the second dose of polysaccharide vaccines after 3 to 5 years.
After 3 to 5 years.
Definitely, you have to provide, but there should be a gap of 2 months between the polysaccharide vaccines and conjugate vaccines. So that means if you are planning to have a transplant vaccination in transplant patient, that means you have to provide the polysaccharide conjugate vaccine first. Then after 2 months, you have to provide the polysaccharide vaccines, and then 3 to 5 years, if it is required, you can have this third vaccine of polysaccharide vaccines.
And second question is, in case of patients suffering from the AIDS, whether you will give before the starting of the antiretroviral therapy or after the antiretroviral therapy?
So actually, this conjugate vaccine, we do not have any trial with the HIV positive patients. Okay, so that means, but for the pediatric population, we have done this trial with the HIV positive patients. So in that case, what we have seen that there is no such change of this particular immunoresponse on this HIV positive patient, but still we can able to have that if CD4 count is very low, then vaccine efficacy will be lower.
In case of pediatric population, you have to give the 3 doses of and you cannot start the heart before, at least if the patient is on stage 3 or stage 4, then you can start the heart therapy. Otherwise, we usually do not start the heart therapy in case of pediatric patients. So you cannot compare between the pediatrics and the adult. My question is very simple: whether we'll start the heart pneumococcal vaccination PCV13 before the heart or after the starting heart, suppose 2 to 3 months after the heart?
So actually, sir, we do not have any trial as of now, so we can't really say. So that is depend on the particular individual choice. Okay, so as of now, but regarding the pediatric population, we had the patient having any HIV positive patient. So then in that case, there is a recommendations, high risk patient recommendation that up to 18 years, although patient has to take the normal schedule, that is 3 dose plus 1 booster dose. Then after up to 18 years, he has to provide another vaccination of pneumococcal conjugate vaccines up to 18 years for the HIV positive patients.
तीन plus booster. T cell, B cell.